Hello and welcome back to Understanding Iron Deficiency, a complete guide. Today we're talking about the failure of medicine to treat iron deficiency. And off the start, I want to say that this is addressing medicine as a systemic issue. All doctors obviously get into it for the right reasons, right? Doctors have the best of intentions. Um, what I'm talking about today are just systemic issues within the institutions in and surrounding medicine that contribute to why there is a failure of medicine today to actually treat iron deficiency and to fully recognize it. And they're pretty basic explanations. It's nothing crazy. Um, we have to understand that when they have normal ferritin levels, how they get that normal is it it's just the wrong way to do it. What they do is they take an average population, a supposedly healthy population, and they just measure all of their ferritin levels, and then they make the levels that would be too low or too high. Um, they base that off of a certain uh, lowest percentile, right? And this is the wrong way to do it because, well, if a third of the population is iron deficient, or in the case of studying females, if half of the population is iron deficient, then the normal is going to be at a level that is iron deficient. And to me, what is obvious is that our normal should actually be um, whatever level results in no symptoms, right? Because that's what we care about. I don't care if I'm in the, the top percentiles of iron deficient or of iron levels. I'm in the top half of percentiles of iron levels. Um, but I have 5 symptoms of iron deficiency. I don't care about that. I care about the 5 symptoms of iron deficiency that I have, and I would not like to be experiencing those, right? I want to be experiencing good health. So levels ought to be based off of good health and not what is normal and common, right? Normal should be good, not common. The normal hemoglobin levels, this one is a bit tricky. Most people, the levels probably are pretty good with ferritin. I should mention, you know, some places will say that a ferritin of only if you're below 12 is bad, right? Um, I believe you should aim for 100 or higher to put that into perspective. But we'll talk a lot more about that later when we're talking about measuring and testing for iron deficiency. For hemoglobin levels, the levels are pretty good. There is a difference that is a bit weird, and I don't know how I feel about it just yet, because the differences for males and females are different. And at first, it's a bit enraging because it suggests, well, is it more okay for females to have low iron levels and to be uh, iron deficient and low in hemoglobin? Um, and I would hope you would say no. That's not okay. Just because it's more common does not mean it's okay. But there are actually differences, and it seems that it's across the animal kingdom. Um, you know, if you measure any other animal, pretty much, except for like hyenas, for example, because hyenas, the females have more testosterone than the males do. Um, Across most animal species, the males do have higher hemoglobin levels. And so it might be right to change the reference ranges for male and female with that. Um, I still do worry that just both of them are a little bit too lenient on what is acceptable. Um, I think that if they uh, decreased the lower or increased the lower range, that would be better. So you have to be a bit worried and skeptical. And I would just suggest that if you're on what they say as the low end for hemoglobin, you should still be concerned and you should aim towards being at the high end. With ferritin, it's ridiculously too low. But yeah, so there are those nuances there. And so that's part of the reason why medicine is failing to address iron deficiency properly. Another just harsh reality, and I'm not trying to be conspiratorial about this, but there's a lot more money into pharmaceutical drugs than there is for dietary intervention and for uh, you know, mineral supplementation, right? That's just the unfortunate circumstances that we're in, and it's a systemic issue, right? Even if all of the people within the system are good actors with the best of intentions, if the system benefits from increasing sales for certain pharmaceuticals, that's the way the system is going to lean, right? It's inevitable, and we have to be cognizant of that if we want to have a system that benefits the patient over the pharmaceutical company. Um, so yeah, it's a lot more common. It's a lot easier almost to just prescribe psychiatric drugs. This is happening a lot. A lot of people go in there, they're as pale as can be, they might have bruises on their legs, they're short of breath, and they feel anxious all the time, or they're depressed and they're not sleeping well. And instead of the doctor recognizing that, oh well, like they're clearly iron deficient, at least, that's my first suspicion. Let's get them tested on that. Um, they just get prescribed a psychiatric drug. And yeah, it's a big problem. And part of it is also what I was saying earlier about the testing, right? The doctor gets the paper back and he says, "Well, it's within reference range, so you must just have anxiety." Um, and I'm simplifying, but that's unfortunately how it goes in a lot of ways. Um, Yeah, so those are some of the big problems with that. Another big problem is that, unfortunately, medical school students are hardly taught about nutrition in medical school. They spend very little time learning about nutrition. My understanding is that it's, a couple lectures at most, learning about what different nutrients do for the body and how to improve and how to make nutrition and dietary recommendations. And it's quite clear that they simply do not understand iron deficiency and how much uh, good nutrition can benefit a patient. So yeah, again, it's a systemic issue. It's not the doctors. They don't have bad intentions. They have good intentions. Emergency medicine is a miracle, but we have to look at the problem that we have with chronic illness, and we have to recognize, with all these people having chronic illnesses, with all these high rates of anxiety and depression, whatever we're doing, it's not working well, right? So we need to recognize that and be humble, take a step back and think about why it's not working. And I mean, this is my 2 cents. I think iron deficiency is a big part of it. We're just not recognizing iron deficiency for what it is, for the big problem that it is. And we're trying to tackle it, as if it's just anxiety, or we're just trying to tackle the symptoms, right? We're not getting to the root problem. So that's all for this video. Up next, we're going to talk about functional iron deficiency. Um, we mentioned it a bit when we were going over the symptoms, but we're going to kind of dive more deeply into that and understand it. It's really important that we understand it, because for a lot of people, this is the problem. It's not that they're not eating enough iron. It's not that it's not wholly that they're not eating enough iron. It's not necessarily that they don't have enough. A lot of people are just really high in inflammation for different reasons, and so we're going to learn all about that. Okay, thanks for watching. If you've been enjoying these videos, please like and subscribe, and I hope to see you in the next video when we talk about functional iron deficiency.